consultant and contractor with CFILC, the California Foundation of Independent Living Centers, Cal and Disaster Coalition. So I'm, you see me here, my description is I've got pandemic neglected graying hair I'm not using any virtual wallpaper. Instead, you just see my hastily cleaned up office behind me. So I don't want any snarky remarks from any of you about that. Okay, let's see. While we wait for a few others to join us, future topics, next month, we have emergency and power planning. What works and what needs work, the California experience. We get lots of questions about this from all over the country. So this is an opportunity to have that discussion and really look at some of the short-term and long-term issues and solutions, how they apply to people with disabilities. Christina Mills will be the speaker. We'll talk about our future advocacy roadmap and some of the potential fixes, legislative, regulatory, utilities, community partnerships, technology, existing and future, charging centers, community resource centers, microgrids, and the roles of community-based groups and more. And then in July 8th, we have Marilyn Golden will be joining me, and we'll be looking at California's transportation issues, accessible transportation issues. One will be an update from Marilyn regarding Uber and Lyft and the push for vehicle accessibility. And the other will be kind of a look at how Uber and Lyft have helped to meet some of the emergency transportation needs, but also a discussion from others in terms of emergency transportation and evacuation options. So that should be another good discussion call to get on your calendar for July. So just a reminder about today, our structure is casual and comfortable. We'll do a panel presentation, 30 minutes, followed by hopefully a robust discussion up to 60 minutes. Again, post your questions in chat, use the hand raising function in the participant list, or voice your question during that period as well. The feedback for today, we always want your feedback, so we'll be doing a poll at the end. But if you have to drop off early, I'll post a link so we can collect your feedback by SurveyMonkey. And again, your input is really important to the way we design these calls and how we justify their value for future funding. Today's call, slides, recording will all be posted at the disabilityDisasterAccess.org, and I'll post that so you'll be able to get the slides and the recording and any other handouts that came with the announcement. So now we're going to look at protecting people with disabilities and emergencies using GIS, Geographic Information Systems, and here from the Inland Empire Health Plan here in California in terms of a real promising practice. So our panel members will be Eric Dick, Christy Garin-Martinez, and Shelley Lemaster. So Eric, I'm going to hand it over to you.
Thank you, June. I appreciate it. Is my screen shared? Just want to make sure before I get going.
Looking good.
Okay, fantastic. First of all, thank you for allowing us to present today. It's a real honor every time we are invited to do something like this. This is just one of many kind of solutions we have within IEHP that utilizes GIS. And on behalf of Christy and Shelley, I want to thank you again for allowing us to do that. My name is Eric Dick, and I'm an analyst for healthcare analytics. And, you know, I do a lot of analytical work, but my main focus is with GIS, Geographic Information Systems. And we have a very robust system, thankfully, within IEHP, and we get to do a lot of great things. So when people ask me, you know, what do you do for a living? I say I get to make maps. And then they say, well, what does that look like? And I say, well, it's kind of a big coloring book, you know, just computerized. So it's fun. It's interesting. So, and I like to do it, especially with situations like this where we get to help people. So today, what we're going to do is we're going to go through a few scenarios that actually apply to this specific application. I'll give you a little bit of lowdown on what IEHP is and where we operate. And then there's a couple of challenges that get presented just from the areas that we operate in. So get over here. And it's going to take a second, it looks like. There we go. Okay. So Inland Empire Health Plan is a not-for-profit Medi-Cal and Medicare health plan, and we're actually headquartered in Rancho Cucamonga, California. And for those of you who don't understand or are not familiar with Southern California, the Inland Empire is basically the counties of Riverside and San Bernardino. And it's, as you'll see in some of these maps, they're huge geographic expanses. They're just monstrous. So we have a large area to cover. And we're one of the, I think we were the first Medi-Cal health plan, managed care plan in the two counties. We're licensed, we're a Knox-Keene licensed plan, and we were organized by the Joint Power Agency. We're accredited by the NCQA, which is the National Committee of Quality Assurance. And we have, this is, looking back at the slide, it's a month ago. So a month ago, we had 1.35 million members. And to kind of put that into perspective, the overall population for these two counties is around 4.2 million. So we basically are responsible for the healthcare of about 30% of the population. And we're well aware of that. We know that what we do as far as outreach goes into the communities doesn't just affect our members, but affects the communities that they live in. We know we have a huge opportunity to make a positive impact on our communities throughout the Inland Empire. So with these two counties, like I said, it offers us some challenges. And again, if you're familiar with Southern California, especially this area, you understand that we are prone to natural events like wildfires. We actually have seasons of wildfires, and we also experience what the power agencies call public safety power shutoffs. And so a couple years ago, the power companies within California decided to implement a program to where if the conditions were right in a specific area, that they would shut down the power lines to mitigate any chance of there being a cause of a wildfire from a down line. And which is a great assertive effort to make sure that the areas are safe. But what we were finding was that we had members that were affected by that in a negative way, especially our vulnerable members that utilize durable medical equipment. So we had to come up with a solution to identify these members so that we can design an outreach to make sure that they were okay. And GIS is at just basically the focal point for all of that. Without this type of software or this type of technology, we would be guessing. And then, you know, the wildfires as well, obviously they're going to affect members as well, or even just that overall population. So this kind of was a progressive application as we went along. Our focus was DME. And then we started talking about, well, what about the providers and facilities? And then we're like, well, what about overall membership? So it was kind of an iterative approach to this process. So we'll go through a couple scenarios and tell you kind of how we designed this application, what it does. So the first scenario basically is all about these PSPS areas, the public safety power shutoffs. So essentially what these are circuit areas that are powered by a central circuit area, right? So a circuit location. And then once the area is identified to hit a certain criteria, whether it be high wind, temperature, they also have to meet a criteria for high fire index. SCE will notify of the members, or actually their customers, about a potential power outage. So they forecast it out a couple days. And then when that area hits the criteria for that day, they shut the area off. So we know ahead of time that these are potential areas. So the good thing about this is these are defined areas. There's not really a subjective approach to it. So one of my colleagues, Darren Moser, he actually is a GIS analyst as well. He went out and he found all of the potential areas that Southern California Edison is responsible for. And so we're able to take those in what's called a shapefile. So it has geographic coordinates for every area. And we incorporated it into our system, into our GIS. And then we're able to locate specific areas based on the power outages. So what this does is it gives us an opportunity to look at a specific area and then find our members that are within those areas. So for this scenario, we're looking specifically at the DME membership. So when you launch the application, this is one of the first things that you see. And this map is essentially, like I told you, you kind of see how big these counties are, right? So it's outlined in red, both Riverside and San Bernardino, with San Bernardino being on top. Most of our web applications follow this type of formatting, where up in the top left corner, you'll see these little 5 square boxes. Those are the queries that you can pull, that you can put in criteria, and it will pull the data out based on that criteria. And then the little dots on there, basically, we wanted to show where our facilities were right off the bat. We needed to see where the hospitals were, where our SNFs, CBAS, and dialysis centers were. This was like a request from the user, like, hey, we want to see these so that we know in relation to one another where they are. And all of this stuff allows the user to click on and off. So if it's too busy, the web application allows you to toggle on and off. So this is like kind of the first thing that you see, right? So you'll see up top our title bar, but then you see underlined there's the SCE shutoffs and the CAL FIRE incidences, which we'll get into next. Those are hyperlinks, and they go right to the websites that we're gonna get our information from. So for this scenario, our workflow basically is we needed to find the PSPS that's happening right now. So what we would do is we would go to the website, which is the SCE shutoff, and then you can see in the top left corner, we're also pointing to a query that's going to look for that so each one of these circuit areas has a specific name. It's a unique name. And when you go to the website and they publish these areas that are shut off, you can acquire that name. So for this scenario, we're looking for an area called Acosta. So what this does is once you get into that Edison query, you can select, or you can start typing in, it doesn't really matter, and it will pop up the area that you're looking for. And once you hit apply, it brings up an area. So this blue area in the middle is the circuit named Acosta. And I'm very familiar with this area because I actually live in the middle of it. And this is a shutoff that happens all the time. Just because the wind comes right down the 15, through the Cajon Pass, and then it blows my walls down. So I see a lot of power shutoffs on an annual basis. But so the magic about this, when we're talking about GIS, is this is not just a graphic. this area actually has location to it. So there's coordinates to this. It's what we call an operational layer. And by doing so, by becoming an operational layer, it allows you to correlate what's inside or outside of this area. So for our purpose, we're trying to find members that utilize durable medical equipment. So if you notice at the top left, we're going to move over to find membership. Now, this is basically specifically any member that utilizes a durable medical equipment, but we can also to get to specific DMEs. So if you're looking for members that are utilizing electric hospital beds or ventilators, you can trim this query down specifically to that, or you can collect everybody. So in this scenario, we're collecting everybody that falls inside this. And now, granted, this presentation is using sample data, but we have to do that just to remain HIPAA compliant. But you'll see that these dots come up, and there's the dots that are within the Acosta area. So what the workflow basically from here is, each one of these dots is not just a dot. It would have an XY coordinate. It would also have all the data that is related to that member. So we have member ID, name, address, phone number. We even have their assigned PCP. So when we export this, all we do is we export a list of these members to the specific business unit. Now, Christy is our point of contact, and Shelley gets a lot of these as well. So from there, they can start an outreach almost immediately. And so I think for this scenario, it would take maybe 5 minutes for the user to pull this data. Rather than in the past, we're guessing, we're all, well, what are the cross streets, or what does the cost to look like, or are we going to wait for members to call in for service? We no longer have to do that. We can take a proactive approach and reach out and say, hey, you're about to be shut down. Are you experiencing a power outage? Do you need help? And from there, we can just kind of move toward making sure that that member is okay. Now, that's a scenario that is for the power shutoffs. And it's great because it uses a defined area, right? Acosta is never going to change unless Edison decides to change the circuit area. Well, and if that happens, then we just update our shapefile. So.
Hello.
Okay.
And who's calling?
Okay, so our next scenario basically has something to do with, well,
I don't have. I'm in a meeting. I'm in.
He said, yeah.
What happens if you don't have a defined area, like a wildfire, right? So these kind of go hand in hand. It's a very similar approach, but we needed to allow the user to kind of create a subjective area. And that's where our next scenario comes in. We wanted to be able to allow the user to not have to be locked into a specific area. And so what does it look like? Basically, a wildfire doesn't have any boundaries, right? Yes, there's areas that they're going to burn more in, but the reality is you can't say, okay, this is the square that the area is going to burn in, and the fire is going to say, okay, I'll stay there. That's not going to happen. So we need to update as the wildfire gets larger. So we brought in some functionality that allows the user to be subjective and actually draw an area on the map itself. And what this does is it allows our business units to coordinate the care and services for these members within these burn areas. And it also provides the information about providers and facilities that are also in those areas. So similar to what we would do with the SCE or the Edison shutoffs, we would go to the CAL FIRE instance. Now, CAL FIRE they have a very robust GIS. They update it as much as they possibly can. They keep historical data, so you can see what happened back in 2019. And then you can see these burn areas, and they update these burn areas as they come along. So it allows the user to kind of identify to see what's happening with these fires that are currently, and it gives you updates on how many acres, all that type of stuff. So it's great. So what we would do is we would go to the CAL FIRE website, We would identify the area that they're talking about, and then it would allow the user to kind of generally follow what they've produced. Now, they've updated their system since then, and I'll touch base on that in a second. But for this scenario, basically, we're going to see the user. What we've done is we've included a draw tool. This is basically like Paint or MS Draw, or a very basic drawing program that you would see when you were younger, right? And this is where the coloring book scenario comes in. That analogy, basically that's what it is. This tool allows you to draw on a map a specific area up to whatever you want it to find, and then that area becomes an operational area. So it will have geography. It goes beyond just being a graphic. So as we zoom to this area, you'll see this yellow area that kind of goes up into Running Springs area, all that type of stuff. This is our fire boundary, and this is a realistic burn area. And now this area becomes that area of analysis for our membership or our providers. So this, we talked about DME for the Edison scenario, and we kind of stepped into, hey, we're also going to look for providers and members. Well, we map out our membership on a daily basis. So that's already available for us. So we wanted to see what type of impact this fire is having specifically on our entire membership. So what it does is it allows us to use a query for our members that fall into that zone. So it's a very basic query. It's going to ask you, well, where do you want to find your membership? And you're going to use the fire boundary. And then once you do that, it pops up all the members that are being affected by the fire. Now, similar to what we have as far as the workflow for our DMA membership, these dots carry the same type of demographic information, members ID, age, phone number, PCP. We could put chronic conditions if we wanted to. I don't know how entailed we wanted to get, but whatever is attached to this member record, we can include in the web application. And then from here, we can export it and then send it to the business units that need to do some sort of outreach. So it's a very versatile type of tool. It's not just limited to a specific population, whatever we want to include in this one. So again, we talked about provider as well. So we wanted to see where our providers are as opposed to where this burn area is. And we need to, our provider services team needs to reach out and make sure that they're okay. So we map out all of our providers and facilities on a daily basis, just like we do with membership. And this allows our teams to not only see the provider PCP, it goes down to specialist, facility, you could have SNF, LTC, whatever we have that's available as far as our provider data is in this web application. So it allows our business units to kind of pick up and see that there's 5 locations that are being affected in this burn area. And then again, each one of these locations has demographic information for the provider, so they can reach out right from the web application. They don't even need us to produce a list. They can just do it right from here. And it's just to make sure they're okay, because sometimes DHCS or Department of Healthcare Services requires us to reach out to these providers and see what offices are still open, what offices have closed, and then we need to provide that information to them just to report. So we had to do that in the past. So this application does it within minutes. So that was our provider members, kind of all together. And I'll kind of go over this. This third scenario is basically an actual scenario that happened. We had a wildfire that was burning up in an area, and we had one of our facilities was being affected. And so we used the web application, first of all, to find what facilities are being affected by the wildfire. And then for this area, it was a SNF location, a skilled nursing facility. And we were able to find the SNF, which you could barely see. I know green doesn't contrast very well with this yellow, but at the bottom of this burn area, you can see there's a green location. And that's basically a SNF. It's one of our ancillary facilities that we utilize. And within this facility, we can see up at the top of this list that there's 14 members that are actually at that facility. And we knew that they were probably going to be evacuated. So what we were able to do is, you can see from one of the first slides that I showed that we have ancillaries that are already mapped out on the list, and the SNFs are pink. So you basically, the user just looks for the pink dots to see what's the closest that's not being affected by the burn area. So our business unit was able to basically say, okay, I see that this SNF is being affected. Let's see if we can transport these members to another SNF. So they could call these other SNFs and say, hey, do you have beds available? Do you have availability or openings so that we can move these members over temporarily? And what this did was that normally the scenario would be, if the SNF couldn't find a location themselves, then these members would be transported to a hospital or emergency room, which you can only imagine during an event like this, they're already inundated. Plus the cost behind that and all that type of stuff, which is kind of secondary to us. But, and you know, who wants to be in an emergency room? So we felt like this was a better option for them to kind of transport them. And then we can help facilitate that as well. So just basically using the web application, within a couple minutes, you can see how many members were affected. You can make the phone calls and you can start coordinating care. So that's basically it. It's like we've, you know, I've touched on the advancements of what has happened, or the changes that have happened since we've developed this initial web application. And I'll kind of touch on what CAL FIRE is doing now. So we see that right now, this web application for the user is required to draw that area. And being as advanced as CAL FIRE is, now they're supplying an actual burn area that we can tap into. So the user no longer has to draw the area. So if a fire is over a certain acreage, then we can tap into that what's called an API, and then we can bring that layer into our web application that's being updated live. So if they make it bigger or smaller, or if they say it's put out, then it's updated automatically on ours, and then we can see that reflected when the web application is refreshed. We have had some challenges with how Southern California Edison now reports their outages. So we've had to adapt to what they do. In some ways, it's easier, but in some ways, it's also limited. So this last year, instead of publishing the names of the circuit areas, they now no longer do that. They publish the areas that are actually out. So they publish the PSPS areas, and then California Office of Emergency Services has that available in their GIS. Now the challenge with that is you have to be what's called a named user, and you have to ask permission from Cal OES for every specific user that you have. So for us, within our organization, we have 3 users. So what we did was, in order to kind of not circumvent, that's a strong word, but in order to work that situation out, we created another web application. So we have this user application that I just presented, and then we also have an administrative application that the 3 named users have access to. And what that does is it allows the named users to get the information for those PSPS, and then we can actually move those along to the users for this main application. So it's kind of the same thing. And we're just giving you this, we're the ones that are giving you the names, and you're not necessarily going to Edison for the names of the circuit areas. I know that might be a little confusing, but on one hand, it's easier because we don't have to go through every single area. It's all right there in a list. But on the other hand, it's a little more difficult because you have to be an authorized user. So a little bit of a challenge there, but I think we've made it work this past year, and hopefully it'll stay the same. Or if they could just open up the layers publicly and we can tap into them like we do with CAL FIRE, that'd be fantastic. But you know, that's up to them. So with that, I'll hand it back over to June. And if you have any questions, just let us know. Thank you again for allowing us to present.
Thanks, Eric. That was just a lot to absorb. A lot of interesting information. Wow.
Sorry.
No, it's great. As people, warm up with their questions, and I know they will. Again, put your questions up in chat or raise your hand, and we'll look at the participant list. So, Eric, Christy, Shelley, just a question to begin. I hear an echo. Okay. Do IEHP case managers use a triage system regarding who to reach out to first to help determine which members are most impacted because of their use of, let's say, life-saving kind of equipment like a breathing machine, respirator, ventilator, that kind of thing? Is that part of this work?
You're on mute, Shelley. You're still on mute.
Yeah, Shelley, your mute button does not show mute, so you might need to call back in. I don't know. Megan, any idea there?
Shelley, this is Megan. I think
Okay.
you called in on the phone and that looks like it's muted.
I think we hear you now, Shelley. Hello?
Okay, I think while Shelley is trying to figure out her system, I can go
Can you hear
ahead
me now?
and respond.
Yes.
Oh, there you go. Go ahead, Shelley.
Yeah, we were muted as a group and I didn't do the *6. That was the issue. I apologize. Christy, yeah, if you could go ahead, maybe do your part for utilization management, and then I'll be happy to answer questions.
Okay, all right. Hi, everyone. So first of all, when we, before we, I think it was very important that we do take into consideration what type of patients do we want to outreach to. So what we did was actually get all the CPT codes of the life-threatening DMEs, like the anything that's related to suctioning, and the electric beds also, because then if you are having fires, want to make sure that all those, anything that is related to that is not just battery operated, but also like I said, the powered wheelchair, although those are less priority, but definitely the airway life-threatening are the foremost. So we loaded those up, or we gave those all information to Eric, and then he crosswalked it with our membership, whoever is receiving them. So whenever there is a disaster or a situation, Eric in the morning, first thing in the morning, he's very proactive, and thank you for that. When there is fire, first thing in the morning, Eric is already sending me that. So that's the first thing I do when I know that there's a fire. I looked at what Eric has sent me, and then I forward it to Shelley's team. So to answer the question, he was one who gave the foundation to Eric to build into the system, including all the skilled nursing facilities that we contract with, or dialysis, home health agencies, all that, hospice agencies, because we're not just using this for fires right now. We want to build more into it and see where we can utilize it in the future. But for now, we're using it for the emergency fire and also for the COVID skilled facility outbreaks during this time, and then we give it to Shelley. So Shelley will take it from there.
And
Thanks, Christy.
Before we go to you, I just want to clarify so everyone knows we're on the same page. CPT codes mean?
So CPT codes are when a pre-service request comes in, any equipment they have from the state, they have a corresponding, they call it CPT code. Sorry, I cannot tell you what CPT stands for. I just know that that's how we pay, we get reimbursement from the state, and that's how we pay our provider services.
Okay, so yeah, I used to know what it means. It's a billing code, but so whether you get a new member or it's an existing member, you find that these CPT codes are accurate indicators of this equipment use?
Yes, because they are the ones that authorize. As long as we authorize them, then it gets into the system.
Shelley, over to you.
Okay, thanks. Thanks, Christy and Eric. This is where it gets more, I'm hearing an echo. Is everybody muted? During these times, we get this list from Christy that is sent by Eric, and then our behavioral health and care management teams take it from that point to make the outreach attempts with these members that obviously have a lot going on anyway, both medically, a lot of times behavioral health wise, and then compounding that, then you have an emergency situation such as a fire or the high winds with electrical power shut-offs. So it's very important to get to them as soon as possible. So during these times when we get the list, we do make that high priority. Our business units are divided by line of business. So we have our Medicare Medi-Cal team, our dual members, and then we have our Medi-Cal line of business. So I distribute these lists to our two different business units, and those managers pass that on to their care managers, who begin immediately making the outreach calls to the members to make sure that all their needs are being met and make sure that there's no interruptions with any equipment that they have, the DME. And then a lot of times it's a good thing. You never want to have to use this system, but it's a beautiful system that Eric and team devise. Very beneficial tool, and we're so glad that we have it. It does give us an opportunity to check in with the members, and a lot of times during these calls, it's not just the crisis at hand, the public emergency that's going on, but there's a lot of things that we can help them with that maybe has been going on. We've run into situations where a member has or is close to running out of their medication, so we're able to resolve that issue. Maybe they have a question about an authorization or referral to a specialist. We can follow up with that. They need transportation for an appointment. We've had a few situations where a member has had high anxiety because of what's going on with the fire situation. And then we're able to connect them with the behavioral health care management to help de-escalate them and assist them, even connect them with ongoing mental health services if need be. So they're very, very valuable calls and a lot of good feedback. We get a lot of feedback from members that are appreciative of the calls and are surprised that a health plan is calling in these situations to make sure that everything is okay. So I'd be happy to take any other questions about the calls that we have with our members and our process.
This is Megan.
I do have a couple questions, comments, if that's okay.
Sure.
Lisa,
Of course.
Hi, my name is Lisa Hayes, the Executive Director for Rolling Start. We are the Center for Independent Living serving the San Bernardino County. do want to appreciate you sharing. This is, we had no idea you guys were doing this work. This is great. I can equally share our challenges with Edison. I don't know if you are familiar with the program that we have, our disability disaster access services that we provide here, and where we're, supporting consumers that use devices like CPAPs and, power chairs, whatever, providing backup batteries. We also coordinate, alternate locations to stay if a consumer is being affected by a public safety power shutoff. Looks like there's some opportunity for collaboration in the work that you're doing, as well as with what we're doing. I did want to first just, the last person asked, CPT codes are current procedural terminology, and they're usually referred to the services and procedures that are performed. I think maybe what you may have meant were HCPCS, because often that's what durable medical equipment is being provided to that consumer that we serve. So if they're using a CPAP, or they're using an oxygenator, or they're using a power chair, a lot of those things have HCPCS codes, which I don't know if I remember the HCPCS, healthcare common procedural codings, if I'm correct. But anyway, so just my geekiness in 25 years in managed care, sorry. I know I do want to ask, the map that you guys showed, are you only working with, helping folks in CBAS, or CBAS facilities, nursing facilities, board and care facilities, or are you also individual consumers? And how are you identifying, the consumers? Is it only like within your databases that are using certain devices, medical devices? How is that, the individual consumer living in the community that has, a power chair, uses, might need to suction, or have a trach, or perhaps has a power door. All of these things, they would be significantly affected by a PSPS event. So I'm just curious, are you just singling out the people in these facilities, or are you outreaching to those individual consumers living in the community?
We do include the individuals living in the community. So anybody that has those codes for those particular pieces of equipment, then they would be included.
And it's just being mapped to whatever is in your system?
Mm-hmm. Yes.
I'm wondering, I'm just thinking about the consumers that maybe you don't know that are using a CPAP, or, I know we had some early on discussions with Edison on whether or not a CPAP or BiPAP was a life-saving device, which was an interesting conversation with them. But, and if a person's using it and needing it to, or at risk of, not breathing at night, that's a pretty critical piece of machinery. So I'm, I don't know, I'm just wondering what opportunities we can to work together to make sure we're really identifying those folks that, you might not even have in your system that are using certain devices. I don't know.
Yeah, hopefully we would, because if we're the ones that authorized it. So hopefully we would have that information, but it's a valid point that you make, and something future discussion for sure.
And Bruce, I see your hand up, but before we go to you, Shelley and Lisa, does your team have the ability to override or to augment the sorts based on Lisa's question? So let's say I'm a new member, and my state data that comes to you may not be all that accurate. And I use a CPAC, and I use a scooter, and I use suction or whatever. Can you override or augment the the way the sorts get done when you have additional information that may not be indicated by the HIPAA or CPAC.
Mhm. I'm going to defer to Christy and Eric on that one because it would involve codes and then Eric with the mapping piece.
So I'm trying to understand. Oh, go ahead, Eric.
Well, yeah, so currently what is mapped is what's in our database. So if it's a situation where something's been coded incorrectly or something hasn't been coded and that member is utilizing a DME but it's not coded, then they wouldn't fall into the universe that we're mapping. So we would have to be aware of it, fix the problem, and then the next day they would be it would be rectified. So it wouldn't be something that a user can do on the fly. Once these data sets are mapped, then they can't do anything to modify them. Now they could use, say, like if Christy said, "Hey, I just got a call from a member that's using a vent and we don't have them on our list. This is their address." Then she could actually go up into the web application, type in that address, and it would bring up their location. And then you can see whether or not they're in the area or not.
Yeah, I think the risk. Hi, this is Christy. I just want to add on what Eric said. I think the risk for us is if the members have transferred or moved location and we are not aware of that, then we will not be able to, track the location of that particular patient to that mapping system, right? However, though, all of the patients since we are the health plan, so we authorized them and we actually collaborated with our physician delegates or our delegates, our providers, to provide us also what they have for their members. So we can only, to your point, if we only get what we are supplied with. And as far as is concerned, all those pre-service requests that we have authorized. And so you are correct in a way that there might be some people that fall off the cracks. Like, for example, if provider delegates did not provide us that information as well, then we can only go with what they give us. But as far as our direct membership, where we are the authorizing party, then those all get into the database and given to Eric.
This is Lisa. If I could just really super quick follow up. If I remember correctly, in the DHCS files the member files that you get on a monthly basis, they don't really include things that durable medical equipment or that consumer uses. Is that correct? So you're actually having to either, if it's a delegated member, to a health plan, to another medical group, you have to get that information from them, or if your case managers are managing it, you have to do it from them. Okay.
That's correct. Yes, that's absolutely correct. That's why there is a risk there, because it's only good as what is given to us, right? And we're manually pulling this from our database.
Bruce, yeah.
Oh, Lisa, you finished her.
No, I just feel bad because I keep bogarting the time, and I know Bruce has had his hand up for a while. Sorry.
We have plenty of time, so we'll come back. Go ahead, Bruce.
Okay, so I'm hopefully I'm not asking something that's already been answered, because I had to get on a little late, having some computer problems this morning. This is probably for Eric. Eric, I've been told by Southern California Edison that they, at some point in the near future, will be providing GIS layers of the circuits that'll be out during a public safety power shutoff event. Are you using, or do you plan on using those GIS layers to layer on your mapping system?
Yeah, if they were available, I'd be using them yesterday. So that was a change that they made this past year. Again, Edison's got a very very robust GIS. It's just they protect their data so well. And it was only through some research that I found that they're actually publishing the layers, and Cal Office of Emergency Services is actually publishing them. So that's where you have to go to Cal OES and say, hey, can we use these layers? And then they give you permission to tap into that API. That's where the named user comes in. So they do in our administrative application, we have the live updated PSPS for Southern California Edison, and that's where we identify those areas. Now, if they made that public, that would be a lot easier, because then I could just do one application and everybody could see it.
Yeah, that's what I was hoping that they were going to do. And I've been told that they were going to let some of the, the partners have access to those GIS layers. But unfortunately, I don't have the software for that. Would you happen to have any information on how we could get the software to start doing our own layers?
Well, we utilize a full ESRI implementation. So I don't know what level you need to be, but ESRI does have several packages. You know what? They're expensive, but it just depends on what you want and what, from what I understand from ESRI, their goal is to let everybody use GIS, no matter what their budget is. So if your situation calls for it, they could, and I'm not speaking for them, but they could donate whatever, So it depends on what your purpose is. So if you come at it from that perspective, they might be able to help you out.
Thanks. Appreciate it.
This is Megan. There's a couple questions similar to that, Eric. So somebody says, are you using Nearby for the Esra Geo app? And can you overlay the fire area with the SCE circuit areas?
So we have, like I said, we have a full Enterprise ESRI implementation. And we definitely benefit from ESRI being, 10 miles away. We've been working with ESRI in an official capacity since 2012. And we have what's called a collaborative relationship. We allow them to come in and work with us on site for our applications and our solutions, and then they help us develop web applications such as these and processes that they can develop and sell, or package or whatever they want to do. So we've had a very good relationship with them for a long time now. So, and we've seen a lot of advancements in the technology and how we use it within IEHP, and they've had an opportunity to step into healthcare and work with the data and see what our uses are, and be able to advance themselves that way. As far as the layers go, yes, absolutely. So if you have two operational layers like fire and a power shutoff area, and they overlap each other, you can utilize that to collect the information. So there's no limitations there as far as operational layers. In fact, we do, the scenario only showed one power shutoff area. When the reality is there's sometimes we've had up to 12 or 13 of them. And because they hit the same areas. So and some of those areas overlap one another. So we collect all at one time. We don't just go, by area and say a cost of this one, and then, university that one, and then collect membership. We hit them all at one time. So we create one list.
Great. We have another question in the chat here. They say, considering HIPAA limitations, have you been able to figure out how to share this info with local emergency management responders?
So this is a process that's in development. Our director of business continuity has been working with the local agencies to see what what they need, what would be helpful. Now, obviously, HIPAA is going to limit us into what we can actually provide. HIPAA doesn't give a whole lot of specification in regard to actual GIS. They do some limitations as far as geography goes, but they don't really address like a GIS application where you're talking members on maps. But they're like I said, it's a work in progress. We've been working toward it to where we can aggregate to certain levels. We have geography that doesn't necessarily have to follow zip codes or cities or those types of administrative boundaries. We've created several resolutions, is what they call them, of hexagons or hexagon tessellation at square mile, 4 square mile, all that type of stuff. So we're looking to aggregate to those levels and see if we can eliminate any type of re-identification that way. But again, that's kind of a work in progress, and it really depends on what the need is from the agency themselves, because that might not be useful to them.
Thank you. Another question here is, how do you identify people who are power dependent but not DME users? For example, those who need refrigeration for medications, or those who are dependent on temperature for stability and need air conditioner or heating.
I don't know if we do that right now. That would be like a Christy Shelley answer, I guess, or a question to them. We would, whatever, if it's available as far as a code or an identification that we can apply to a member, then we can map it. But we would have to be able to identify them somehow. It couldn't be just like a general or a general person or whatever the case may be. They would have to be in our database identified as a certain type of user.
Yeah, that's currently a bit of a gap. The only thing I'm thinking, Christy, is maybe we could, identify them as insulin dependent somehow, perhaps for future.
Yeah, so pharmacy.
It's a good idea.
Pharmacy has this with Shelley with the continuity of care. So maybe, yeah, that's because when we initially started this, we just started with DME, and that's a good thing to bring up. Although I think Eric, we include the insulin dependent because pharmacy was in that meeting. If not, then that's probably our next steps, is to ensure that the ones that the pharmacy has identified, that we will also include it on the database. So thank you for bringing this up. So
Yeah,
make sure that
definitely.
we'll follow through with it.
This is June, before we go on, Megan, to your next question, just to probe that a little more. Yeah, there are a number of issues, like the questioner asked, beyond even insulin, other medications and breathing issues that are power dependent, that are kind of out of the circle we're drawing right now. So just understand, like, is there a manual way to permanently affect who's popping up? Like, once if I'm a case manager and I know that Lisa uses a very atypical kind of machine that she's had since birth or whatever, not coming up in Hipaa, CPAP, CPT codes or anything else, as well as these questions about other kinds of power dependent issues. Can the case manager or other designated staff enter that so it becomes a permanent part of what comes up as a priority?
I think that's a process change. Yeah, that's
Yeah.
that would be something that we'd have to have in the database, some sort of indicator. No, you can temporarily do that in the web application itself if you know for sure that this person, meets this criteria, but they wouldn't be represented persistently through the data polls. So somehow we would have to have some sort of indicator saying that this person needs to be part of this list.
Yeah. What I can add to that, June, is that when I reach out to our care management teams to call the members, I remind them to go through their caseloads. They should know their cases well enough. They should know who has that sort of situation, and then I do encourage them to go ahead and reach out to those folks as well, especially if they're not showing up on the list. Yeah.
Is there a fail-safe system? I know you have a number of health surveys you work through with members. Would any of those surveys pick this up as an indicator of a field sort that could then be integrated quickly into the database?
Yeah, that's possibly something that we could look into. We do a health risk assessment with our members, and maybe there's some way of linking that information. Yeah, these are great suggestions and points that you're bringing up.
Back to you, Megan. Thanks, Shelley.
Thank you. So our next question is from Claire, and she says, what role do the local jurisdictions have in reaching out to the medically vulnerable populations during a PSPS or fire events? And what role does IEHP take there?
Well, everything that we do it on our own initiative to try to do everything that we can for our members. As far as the local jurisdictions, I'm not an expert. I can't speak to that exactly, other than Edison does their bit with notifying consumers. But I know our facilities department, they keep a watch on events that are happening. So we hear about these power outages and fire evacuations. We hear from them and then take the ball at that point. So I don't know if Christy or Eric, anything differently, but I know, we like to take a proactive approach as many times as we can, just to be on it and to help our members, out of some difficult situations.
I think the situation would have to be more general. I'm sorry, Christy, I didn't mean to stomp on you. I think it would have to be more general for a city to get, for a municipality to get involved. Just because we can't give the cities the data that we have just from Hipaa. Right. If it's a massive event, and they would have to have a dedicated resource. So I think there's a little bit of maybe an issue with the resources available for specific situations like this. Programs, I think we've had some cities in the past that have extended themselves to, like Healthy RC for one, has asked, what they can do to help, but it's limited. Our areas are so huge compared to those city boundaries. So it just depends on what type of bandwidth they have as far as resources.
Yeah, during this pandemic, I just want to point out that public health counties have been collaborative with us, and that's where the skilled nursing facilities come into play. So we kind of leverage our relationship with the public health counties, with San Bernardino and Riverside, during the pandemic, especially with the outbreak of COVID. So that's one that I know that has been, and up to now, it still happens. That is one that I know that has been at least a strong relationship there. But other than that, I am not aware of, other jurisdictions.
And Lisa has her hand up.
I thank you, because that was actually part of what I was going to ask is who else are you working with as far as in the counties? I'm wondering, so that we're not breaking, I really am so excited you guys are doing this, but I really want to try to figure out how we can support your efforts with our DADAR program. One of the things, our membership association, we get out to all of our consumers as a survey. Is it possible, and what basically happens is the survey basically helping them identifying what their needs are. I know you can't actually tell us what consumers need to support, but if the consumer contacts us directly, that's a whole different ballgame. So, and I'm wondering if there's a process or something we could develop so that they could, hey, we're going to send you a quick survey from one of our core partners. We'd love, to answer that. They offer some services that could support you in these PSPS events or other power events or training, because we do a lot of emergency preparedness training, and get people 3-day go bags. We do a lot of things that I think could really support your members, and that would particularly, I think, be responsive to some of this. Do you think some of that could happen, or?
I think we could definitely have the. Go ahead, Christy.
I was gonna say that like what I think what Shelley's gonna say is that would be something that we can take a look at and then discuss further, because with a service like that, and you have to be able to do something about whatever whatever comes out of the survey, and make sure that we have the bandwidth to support. Now, if it is within our members, I think that that is a great idea. We just have to be cognizant that we cannot support everyone outside of unfortunately IEHP membership, but we have a big membership. It's growing right now, so most definitely I think it's worth exploring.
Yeah, and I was going to add to that. I think it would be great too. We could loop in our Director of Community Health, Gabriel Uribe, who oversees the Independent Living and Diversity Services business unit, and that would be a good discussion we could have.
Excellent point, Lisa. Todd, did you hear your hand up?
Thanks, June. Can you hear me?
Yes.
Just a quick question, if I could. I put in the chat as well. With GIS becoming more, having a broader reach, I'm curious if having fire danger warn us when it's time to evacuate, say, a skilled nursing facility. Could it work the other way for us in that it could show us where not to evacuate people to? For instance, places where if they're gathering information about variants on the COVID-19 virus, where a hot spot would not be a good place to bring people to.
If that type of layer was developed, then yes, we can incorporate that into the web application. Right now, we keep track of those who have had their vaccination, but again, it's just membership. So we're not collecting, all of the information for the 2 counties. We're just collecting what's in our member databases. So we have, we try and provide an indicator for every member, whether they've had 1 dose or have been completely vaccinated. And then we incorporate that into some of these geographic layers. So, I mean, we would have to develop a process to identify those hotspots, or we would have to utilize like an outside source. But we vet, when it comes to GIS, we vet those pretty robustly. Like, they've got to be right on in order for us to use them. So I would have to know the process inside and out to how they develop those areas.
Thank you, Eric. This is Todd. This seems like it's an area where we're going to start to see benefit from the ability to be able to do this as we go forward. Climate change is hitting us on all fronts, including the increase in pandemics, along with the other natural disasters that happen. So I think having your data available and having it, thinking about it now rather than waiting until something is developed, I think having people working on that development so that the systems are talking to each other will be really beneficial for all of us.
Thanks, Todd.
I-
Eric, go ahead.
No, I was just going to say I agree, and that's one of the benefits of having ESRI involved in some of these processes is they can see this. We're limited in what we can share as far as IEHP, but because ESRI is alongside us in developing these types of web applications and methodologies, they can take those methodologies and be able to apply it to general situations. Like you're saying, they can bring in data sources and they can bring in census data and start developing applications on a more general level that is not necessarily protected.
Two things, a reminder to all of you, there's a robust discussion here in chat, as well as some listed resources for nonprofits being able to access some of the ESRI and GIS software that's affordable or at no cost. Shelley, this is a question for you. When you determine a member is in trouble and running out of their, let's say, backup power for breathing, what kind of transportation asset is available to you to deploy and to help that member get to safety and power?
Well, we'll exercise all the, explore all the options and try to get them backup power if possible. We'll work closely with our utilization management department to see if we can get something authorized. Another possibility is if we don't have, they can't stay where they're at, we could look at transferring the member, transporting them to one of our recuperative care facilities, for instance, which is we work with through our housing program. So we have 3 different recuperative care facilities. We have one in Colton, one in Ontario, and one out in Indio. And that would always be a possibility too. We could, as long as that area is good with their power, we could transport the member there if we cannot get them a backup battery, generator, what have you.
So you have
we will
access to an immediate transportation response system?
Well, I don't know. It depends on how you define immediate, but we have our own transportation unit that's under Christie. And, they're very supportive. They're been very helpful in these situations where we've had to coordinate transportation quickly. And as long as we can get a vendor lined up, and our team is on it quickly, and will do everything they can to get it going. So it's all dependent on vendor availability.
So I'm the annoying detail person here. So in your
That's all right.
In your transportation vendor contracts, do you have an emergency response clause of any kind?
Emergency response. Go ahead, Christy. I didn't hear the last word.
Okay. Emergency response clause. So we work with, with our transportation vendors. We work with, so if it's emergency for sure, then we have our ambulance company that actually we work with. So that doesn't need any authorization. So they just call that in. So for any vendor, urgent but not emergent, definitely when Shelley calls us, that's a priority for our team. We have a team that kind of prioritizes, this kinds of situation. And so we have other than the broker, we also have our own provider vendors, private provider contractors that we can call. So we just have a lot of, quite a handful of transportation services that we can call. So far, we have not had any failed transportation requests. So I think that for the emergency, again, they will just call that 911 call, and then it will be serviced by the ambulance, and for the urgent ones, then we will prioritize that with whatever Shelley is requesting for. So.
Thank you. Megan, have we missed anything in chat? There's a lot there, and did we cover most of the questions in chat so far?
I believe we did. The one I think we're missing is somebody said the proactive approach you're taking is truly impressive. Are there any other health plans that are doing something similar?
So as far as I know, we work with Texas Children's Health Plan, and we collaborate back and forth. We were kind of the example for them to get up and running as far as our GIS, but since then they've really shined in what they're doing over in Texas and what they've done. So they've taken a little bit of what we do here and have incorporated the same type of methodology. I think they deal with floods more than we do, but it's basically the same thing. So yeah, and I think that's the only one that I know of off the top of my head.
Eric, what part of it, where in Texas is that?
Well, it's Texas Children's Health, and they are, I can't remember how many counties there, but it's it's probably, I want to say it's almost the entire north side of Texas. Oh. So they showed me that, you take a look at our two counties, and our two counties probably, they have a ton of counties, but they're all little squares, and we think they're really cute how little their squares are. But they have a lot of counties, but it's probably the same, maybe a little bit bigger than our geography for our two counties. So,
well, let's see, Todd, is your hand still up or up new?
Thanks, June. It's actually up new. And a quick question for you, Eric. I noticed today, due to the pipeline hacking ransomware incident, the president was talking about new plans not only for infrastructure but also for Department of Homeland Security, having folks being placed in charge of protecting these systems, including, I would hope, above all, yours. And I was just curious if you have ever seen, or have you identified any potential threats? Has anybody shown any interest to wanting to get into your systems and cause havoc, as egregious as that might be?
I think we probably see threats every single day. I'm not necessarily the right person to ask. Our IT department is constantly updating and making sure that the threats are mitigated as far as that goes. What I presented today is actually behind our firewall, so that you'd have to be a network user to see any of the information that I showed. We do publish some public applications, but those don't contain any type of member information. So we kind of, IT does a great job in protecting the network as a whole, and then GIS has our own kind of protection as well, as far as our named users and the ESRI safeguards as well. So, but I don't know. I don't think they would ever let us know if we've had those types of threats. It would just be too scary to know.
Thank you. I'll sleep a little bit better tonight.
Sturdy question. Thank you. I want to go back to Lisa Hayes' question, Shelley, Christy. The handshake with the independent living centers in your area that are heavily involved in the public safety power shutoff program and identifying people who are power dependent and helping them to get what they need to be more resilient in these PSPSs. I'm concerned about, and I know you are too, the sustainability of this program for the long-term power outages as well. So question is, you mentioned Gabe and just wanting to explore more with you for the last couple of minutes, maybe the handshake, because independent living centers in your area could probably easily identify, the people identifying to them who are indeed IEHP members and get permission to share their info with you. So I just think it's ripe for a enhanced community partnership here. So
Yeah, I would agree. I think that'd be a very good discussion to have for future planning purposes, because, of course, we're only going to have more of these events, unfortunately. It's best to be ready and help as many members as we can.
Yeah, our state association, we had a meeting the other day, and we're looking at probably doubling the PSPS events that occurred last year to see that this year. So, we really need to, I think this is a great opportunity to work together and perhaps develop some type of a model for other centers, because our Northern California centers are really have been significantly impacted by the fires, obviously. And we've had our share, but I would hopefully be able to mitigate some challenges in the event something more critical happens in the Inland Empire.
Yeah.
So
yeah, I would think maybe we could have an online discussion to talk about next steps and maybe get something going. I think that would be a great idea.
Awesome.
good, great. Any more questions? I don't see any, so we can get some poll questions for all of you before you drop off. But first, I want to remind you, all of this will be posted as a recording on the DAR website, which actually is DDAR, and I posted that in chat, the link. And I want to deeply thank the IHP team and really salute you for leading the way. This is a very impressive and important practice in terms of resiliency and helping people in emergencies. So thank you for allowing us to take a more in-depth look at what you're doing and just sharing with us this really important practice. Very impressive. So, Megan.
Thanks for having us.
Megan, back to you.
Yeah, so we actually are going to have Lisa launch the poll. She logged in second on this account. So Lisa, could you go ahead and pull up the poll and launch it for folks?
I launched it.
Great, and I can't see it since I'm a host, so would you mind reading the questions out for folks so they know what they're answering?
Sure. First one is, please rate how helpful this month's speakers forum topic session was for you. 1, not helpful, 2, okay, 3, fair, 4, good, 5, very helpful.
Thank you. And are there other questions on the same poll, Lisa?
Yep. Please rate your opportunity to participate in a coalition discussion. Looks like we're getting some good answers on all of them. Please, and the third one is, please rate the accessibility of the coalition meetings. Everything from good to excellent on that. How likely are you to attend a future disaster strategies coalition meeting? And it looks like most everybody's looking like it's very likely they're going to come back. This does not surprise me. These are great meetings.
Well, thank you all for doing the poll. And if it wasn't accessible to you for some reason, you can use that link in chat as well. And join us, just a reminder, join us next time for really the handshake discussion to this one, which is more about emergency power planning, what's working and what needs work next month, both in terms of California and what we can learn from outside the state as well. I know many people will join next month for that discussion. So thanks again for you all for joining us and your excellent questions. And IEHP, thanks for your great preparation for our time with us.
Thank you.
Yeah, thanks for having us.
Thank you for all the comments and suggestions as well.
Bye-bye.